In general, most people are familiar with the main modifiable cardiovascular risk factors, such as hypertension, smoking, cholesterol, and diabetes. There are also risk factors that cannot be modified, such as age, heredity, and sex. One's sex affects one's cardiovascular risk, which means men are generally at greater risk of cardiovascular disease than women who have not reached menopause. Recent studies have identified a series of metabolic abnormalities known as metabolic syndrome. Metabolic syndrome is diagnosed when all of these abnormalities are present. These abnormalities include insulin resistance, high blood pressure, endothelial dysfunction, dyslipidemia, and inflammation. They are often observed among individuals who are overweight or obese, and who have a particular form of overweight or obesity known as abdominal obesity. In addition to traditional risk factors, screening for the metabolic syndrome makes it easier to identify individuals at increased risk of developing type 2 diabetes, and possibly at increased risk of cardiovascular diseases. Thus, simply diagnosing the metabolic syndrome is not sufficient to assess global cardiovascular risk. Traditional risk factors must also be considered. Accordingly, global cardiometabolic risk can be assessed by considering features of the metabolic syndrome, along with traditional risk factors. Some authors have questioned the added value of the metabolic syndrome in assessing and managing global cardiovascular risk. Under this model, the metabolic syndrome is not equivalent to cardiometabolic risk. By itself, a clinical diagnosis of the metabolic syndrome cannot be used to estimate global cardiometabolic risk, because the syndrome is only a component of global cardiometabolic risk.